How to do exposure and response prevention for OCD. Exposure and response prevention, often called ERP, is a powerful technique used in cognitive behavioral therapy for treating obsessive-compulsive disorder. It focuses on two main actions: exposing yourself to the things that trigger your anxiety and preventing the compulsive behaviors that usually follow. This method helps reduce anxiety over time, allowing you to take back control of your life. The first step is assessment and identification. This involves a detailed evaluation to pinpoint your specific obsessions, which are intrusive thoughts or urges, and compulsions, which are the repetitive actions you feel compelled to perform. Understanding your triggers and the situations you avoid is essential. Tools like clinical interviews and symptom severity scales can help tailor the treatment to your needs. Next comes psychoeducation. It is important to learn about OCD and how ERP works. Knowing how your obsessions and compulsions function can boost your motivation and engagement in the treatment process. Creating an exposure hierarchy is the next step. This means making a ranked list of the things that provoke your anxiety, from the least distressing to the most. You can use a subjective units of distress scale to help with this. This hierarchy will guide your exposure practice, starting with easier situations and gradually moving to more challenging ones. When it comes to exposure, you will confront your fears in a systematic way. There are different types of exposure you can do. In vivo exposure involves facing real-life situations that scare you. Imaginal exposure means vividly imagining those feared scenarios. Interoceptive exposure involves inducing physical sensations that cause distress, while virtual reality exposure uses simulations to recreate feared experiences. Response prevention is crucial. After facing your fears, you need to resist the urge to perform your compulsive behaviors. This step is vital to breaking the cycle of anxiety relief that compulsions provide. It allows your anxiety to decrease naturally over time. As you progress, it is important to practice gradually. Work through your exposure hierarchy step by step, increasing the difficulty as you become more comfortable. Consistent practice, ideally daily, is key to success. Self-management techniques can also be beneficial. Learning to recognize obsessive thoughts and compulsive urges mindfully can help you apply ERP principles on your own. This enhances your long-term ability to manage OCD symptoms. Throughout the ERP process, a therapist can provide support. They help you manage anxiety without resorting to rituals, reinforcing that the feared outcomes often do not happen or are less catastrophic than you imagine. This retraining of your brain's response to triggers is what helps reduce OCD symptoms over time. ERP is a structured, evidence-based treatment that requires commitment and often professional guidance. However, with the right education and support, it can also be adapted for self-help. Remember, it is always important to seek personalized advice from qualified mental health professionals to ensure safe and effective implementation of these techniques.